Emergency GBV advisor working on behalf of the Gender-Based Violence Area of Responsibility, or GBV-AOR, which is the global coordination mechanism for gender-based violence in emergencies led by UNFPA. Here for today's purpose, I am also the chair of the regional GBV working group for East and Southern Africa. And it's really great to see so many familiar names on the line joining us today. This is the next installation of our 16 Days of Activism campaign. So I hope that you are seeing all of our videos on our YouTube channel and really spreading those widely among your social media networks. We want to make all of those amazing adolescent human rights defenders go viral for this amazing work that they're doing in pretty complex environments. Before we proceed today, please take note that we do have French, Arabic, and Portuguese translation. Please do look at your screen to access or to learn how to access interpretation in one of those languages. Just going to give 2 seconds for that to happen. Please also note, do keep your microphones on mute throughout the webinar. And also, we are requesting that you please turn off your videos, because we know that we have people calling in from lots of different areas with varying strengths of Wi-Fi. So please do keep your cameras off and yourselves muted throughout the webinar. If you have any questions, please write them in the chat, and myself and others will try to answer those questions in real time. Since we have translation into so many different languages, we find it difficult to have a live question and answer. So we will try to answer questions as much as possible if you write them in the chat. And then if we do have a few minutes towards the end, I will be collating or putting those questions together, and I will ask them directly to our speaker. So please do answer or write any questions you might have in the chat. We will try to answer them real time. For those that we are unable to answer, we will then collate them, put them together for our speaker, who can answer them during the Q&A. Next slide, please. So welcome again to our next event for our 16 Days of Activism campaign. As I mentioned previously, during this campaign here in the East and Southern Africa region, our member organizations decided to focus on adolescent girls. So we've recognized that adolescent girls have very distinct vulnerabilities and risks to gender-based violence, and that often our programming and our advocacy is not specifically addressing those distinctions. And so we wanted to take this 16 days of activism to raise awareness about the specific vulnerabilities and risks that are faced by adolescent girls here in East and Southern Africa, and use this as a springboard for all of us here, not only at regional level, but at global level and at country level, to really make sure in 2025 that we are prioritizing adolescent girls in all of our interventions. As we know that oftentimes when we have adolescent girls who are 15 or 16 years old, their needs don't necessarily always fit into child protection interventions. And then their unique needs don't always fit into the interventions that we had designed for adult women. And so we want to make sure that we are, in fact, identifying their needs and then creating programs and policies to specifically meet those needs. And this is why I'm really excited for today's presentation. I'm really happy to introduce Caroline Maspunji, who is a child protection specialist at UNICEF. And she's going to be talking a little bit about a unique platform that they have been working with Laaha to try and create virtual safe spaces to support women and girls in humanitarian settings. And I think we're really interested to hear about the pilot that they have done in the DRC as a way to increase engagement and access to really vital information that adolescent girls can use to make sure that they're safer, that they have access to important reproductive health information, and lots of other materials. So without further delay, I'd like to turn it over to my colleague, Caroline from UNICEF, who's going to take us through this really engaging platform and show you how you can also engage in Laaha as well. So Caroline, over to you.
Thank you so much, Jessica, and thank you for having me. It's wonderful to see so many people on the line and familiar names. So I'm going to share my screen. Please let me know if you can see it. Can you see my presentation?
We can see it well.
Okay, wonderful. So today, as Jessica mentioned, I will talk to you about Laaha. Laaha is a virtual safe space platform for women and girls that we developed since 2021. So it's been close to 4 years, and I will talk to you a bit about this journey and more specifically about our experience contextualizing Laaha for DR Congo. So, first of all, what did we try to do with Laaha? What was our goal? We wanted to create a digital space, meaning a space online, that enabled adolescent girls and women to seek support, to ask questions, to know where to go for help, and maybe in time replicate what we see in women and girls safe spaces, physical spaces, but also reduce the isolation that builds on, some of the barriers that women and girls have accessing safe spaces. So before we get into our experience with Laaha, I wanted to tell you a bit why, we, our colleagues in DR Congo, some of them are on the line, felt that that Laaha was a relevant option for them. So you know that in Congo right now we have over 6 million displaced. Between January and June, we had over 61,000 reported GBV cases, and 40% of them were children. So obviously, gender-based violence and sexual violence are very much widespread. 39% of girls are married before the age of 18, and close to 9 million people have impeded access to healthcare, including sexual and reproductive health. Plus, we're seeing a lot of widespread negative coping mechanisms such as survival sex or child marriage. So in this context, our office in Congo wanted to explore how to diversify the entry points that allowed girls and women to access safe spaces. So in addition to having physical safe spaces, could we capitalize on the existence of increased connectivity for women and girls in order to ensure they had access to safe spaces online as well? To give you a little bit more context about the relationship between women and girls and technology in the DRC. So access to technology is still very much a challenge in the DRC. A recent report showed that 15% of women access mobile internet, so only 15%. That being said, the previous report from 2023 showed that it was 6%, so there is definitely an uptake in mobile internet, but it's still, very limited. In sub-Saharan Africa, women are 19% less likely than men to use mobile internet, and only 28% of women own a phone. And obviously, there are challenges that you know about, very limited connectivity. This comes on the top of low literacy rate. So 56% of women are literate. So obviously that affects their digital literacy as well. And that is compared to 81% of men that are literate. So then, in addition to that, we know that there are significant economic challenges that impede women and girls to have access to phones. And what we saw from a recent World Bank report is that digital exclusion of women and girls also has a significant impact on the economy. In addition to that, there is also technology-facilitated gender-based violence in Congo, where women and girls face cyber harassment and online abuse when they manage to come online. Non-consensual sharing of images, especially intimate images, is also quite widespread for those who have access to mobile internet. And we see a link between offline and online violence, where TFGBV is often interconnected with offline violence. So abusive partner that use technology to control and victimize women, or also the use of mobile phone to track, intimidate, or manipulate victims of violence. And what we see also in the DRC is that the perpetration of TFGBV predominantly happens via social media platform like Facebook or WhatsApp. So this is just to tell you the significant challenges that there are in the DR Congo when it comes to technology and the implication it has on creating a virtual safe space platform. So when we built Laaha, we wanted to really be mindful of those realities. So initially, and here I'm taking a bit of a step back from our deployment in Congo that happened just since last year, but what we collected stories and experiences from women and girls in 5 contexts, in Afghanistan, in Iraq, in Lebanon, in Venezuela, and in Ecuador. And those women and girls told us, what is the reality they're experiencing. And this is what helped us to shape Laaha. So, for example, a 15-year-old girl, in Lebanon, said, we usually want to know these things, as in information on sexual reproductive health and GBV, but we don't want to ask them. So this is a safe space to learn. A woman, 22-year-old woman in Iraq said, my husband dials and passes me the phone to speak to my family, and I'm not allowed to touch it. So that also shows, the barriers towards access to phone that are oftentimes monitored by male family members. A 17-year-old girl in Lebanon said they do not want us to know anything, and the day after we are married, they expect us to know everything. And a 13-year-old girl from Venezuela said that I wasn't aware about the menstruation because nobody told me until I went through that thing. I was terrified and didn't inform my mother, so she wouldn't hit me. I thought I had done something wrong. So that also shows the extent of which access to information on sexual reproductive health is a challenge in most contexts where we work. In Congo, we held consultations with partners and women and girls to understand what were their opinion of Laaha. What we understood is that they all felt very strongly about the need to access information especially on their body and health. However, they wanted that information to be age appropriate, And they told us they weren't sure where to get access to that information right now. So currently, what came out strongly is the lack of existing knowledge and information on their body and reproductive health. Um, Also, there were a lot of discussion around sexual consent and the legal framework because some of the information we capture on Laaha might not might not completely align with the legal framework in Congo, and so making sure that we gave them the right information so that they could make decisions on how to act upon them. And they identified a number of topics that were needed, like abortion, PSEA, or negotiation skills. So now I'll show you a short video about Laaha.
In humanitarian contexts, girls and women often don't get the information they need about their bodies, health, rights, and where to find help. 1 in 3 women faces GBV in their lifetime. At least 12 million girls are married before they reach the age of 18. This is 28 girls every minute. Access to physical safe spaces is not always available for them. In 2021, UNICEF launched Laaha, a unique platform born out of collaboration. Laaha was co-created with women and girls, turning their voices into action, shaping every part of the solution to truly address their needs.
Placing women and girls at the center of the design process empower them to actively participate in shaping a solution that directly impacted their lives. This inclusion fostered a sense of ownership and relevance, ensuring that the final product truly resonated their needs and aspirations.
Laaha listened to girls and women covering topics like online safety, puberty, and financial literacy. Modules include quizzes, videos, and podcasts. A quick exit button redirects users to Google for safety, and a list of available services is provided. The moderated forum and interactive chatbot offer anonymous support and community. Laaha, a virtual safe space for girls and women.
So now I want to tell you a little bit more about our design process. In 2021, when we took on that task to build a virtual safe space platform, it was a bit daunting because we didn't know what a virtual safe space platform would look like for women and girls, and especially women and girls in our target countries, which are predominantly humanitarian contexts. So what we did was to take a drastic approach in human-centered design, meaning really centering the voices of women and girls as a central part of the design process. So we recruited user researchers in all those countries, and we led consultations with women and girls so they could tell us. They could tell us what were the barriers they were exposed to access technology, like we saw in DRC. They could tell us also the fears and concerns they had online, but also the fears and concerns they had about accessing sensitive information like sexual reproductive health information online. But they could also tell us how we could make them feel safer. So what came out of those consultations was indeed the gender digital divide, meaning that a lot of women and girls in our world right now are still very much excluded by technology, either because of their low digital literacy or because they don't own a phone or have access to a phone, or when they do, it's often monitored. Um, and we needed to account for that by building highly accessible content, meaning that the content on Laaha is very interactive. We have videos and podcasts and interactive quizzes. Every time there is text, there is voiceover. So that also helps overcoming some of those barriers. They also told us that they really wanted to see that information, as you saw in the video, and I highlighted in the quotes. A lot of women and girls said that they didn't have access to any of that information. A lot of women told us that when they had their first periods, they thought they were going to die because no one told them that this was going to happen. So the need to have access to that information was very clear, yet they wanted to feel safe accessing that information. So they told us they wanted to see an exit website button throughout their navigation experience, so that anytime they felt unsafe, they could exit the website quickly. So right now on Laaha, we have over 140 modules. We focused on body and health, like female anatomy, on relationships and rights, help and services, and safety. We have new modules around digital literacy that we build together with the International Rescue Committee and GSMA. We have a caregiver's corner that provides information to women and caregivers about how to talk to their children about sex, or how to manage puberty in their development of their children, but also how to prevent child marriage. We also have content on family planning, and we have a content development strategy in which every time countries or women and girls identify a need for a new topic, we make sure that we put it in the pipeline. So you can access the full content list, and obviously it's a it's a growing body of work and all of our content is Creative Commons, which means that it can be accessed by everyone. So whether within UNICEF or outside of UNICEF. What I wanted to mention is that from our modules, what we see from our user statistics is that the overwhelming majority of users are predominantly seeing the module related to female anatomy. And I'm saying that because often when we deploy at country level, people say, oh, these modules are too sensitive. But by far, this is the module that the modules that women and girls access the most. So that means that it's the most needed. It might be the most sensitive, but it's also the most needed from their perspective. So I mentioned the modules on sexual reproductive health and GBV. Actually, it's now over 140. We have an exit website button that when you click on it, it takes you back to a Google web page. We have access to available services nearby. That was very important for us, that when women and girls were navigating Laaha, at any point they could be directed back to physical services, because a virtual safe space never replaces physical services, case management services, psychosocial services, health services, and so on. So we wanted to make sure that we facilitated that access. And that is also a very interesting tool to use in population movement, like migration movements, where, you know, women go from one country to another, and they can use Laaha as a way to find services across those countries as well. We also have an interactive chatbot and a user forum that we're now deployed in a few contexts. We're piloting it. So the chatbot reproduces the conversation that allows users to find access to more specific content. So the chatbot will ask them what they want to know, and they will be directed to the content. Considering our content is so rich now, it allows them to go to the right place. And then the user forum, the users can ask questions or answer questions that others have asked. It's completely anonymous, and it really allows, and it's moderated by a social worker. And it really allows users to share a sense of community, and that's something that they really pointed at during the user research, is that they really wanted to find a sense of community online. For DRC, we started the process in March 2024, where with the identification of like interest for the deployment of Laaha. In April, we started reviewing the content. So that means the country office consulted with partners and women and girls on how the existing content needed to be adapted for Congo. We also translated the content in Lingala, Swahili, and French. This is still ongoing. I think I can talk more about the translation process, and also I know some of our colleagues in the country office are there and can also talk about that, because definitely, you know, making sure that the tone, the language resonates for those languages is, you know, is not easy. And so that's a process that is ongoing, and we're now preparing for the launch and identifying what those entry points are, considering the limited access to technology and connectivity. How can we still make sure we work with some of our femtech partners to disseminate Laaha? So to talk more about the translation process, I'm going to show you the same. So this is our famous female anatomy, one of our female anatomy module. So those that are considered more sensitive. So I'm giving you a heads up. This is by far the most viewed module. We translated it in Lingala, French, and Swahili, so you can see a little bit. And yeah, apologies to the translator. I don't think this needs to be translated necessarily, but it's just to show you the video in different version. And I'll just show you a few seconds of each.
Totala na ino na muzindo nzoto ya mwasi. Tokolobela na tina na nzoto ya basi. Mingi mingi nzoto ya basi na nzoto ya bomwasi. Makambo mingi elobamaka na tina na bokoli ya minama ya nzoto ya bomwasi. Tala oyo osengeli koyeba mpona nzoto na kati mpe libanda.
This is French.
Parlons du corps féminin et plus spécifiquement des vulves et des vagins. Ils sont assez géniaux quand on y pense. Il y a souvent beaucoup de mystères autour. À quoi ils ressemblent, ce qu'ils font, leur odeur et même comment ils changent avec le temps. Voici tout ce que tu dois savoir sur ton corps, de l'intérieur à l'extérieur.
Tuzungumze kuhusu mwili wa kike, hasa viungo vya uzazi. Mara nyingi, kuna siri nyingi kuhusu maendeleo ya viungo vya uzazi vya kike. Hapa kuna kila kitu unachohitaji kuhusu mwili wako kutoka nje.
Okay. So this is just to show you that, you know, all of our videos, and it's to give you an idea also of what our videos look like, but also what the process of translation looks like. In some contexts and for some languages, we use artificial intelligence, but this doesn't work very well for especially what they called minority languages, like Lingala, for example. So oftentimes the translation has to be done manual, which is more cumbersome and contextualized to the local context as well.
Kwenda ndani. Uke yako ni nini?
Sorry.
Parlons du corps féminin.
Okay. I'll stop here for a second. I don't know, Jessica, do I have time to do a quick demo of Laaha?
I think that would be great. Just maybe if you could answer 2 questions very quickly, because there's definitely some trends in this chat. The first one is, what is your advice for individuals or groups that are working in low resourced areas that lack internet access or might even be controlled by military groups? We had some actually good responses to that, and maybe I'll come back after you give your feedback.
Okay, so I think maybe they are slightly different. So I might answer the first one. So in terms of the low resource context in which technology is a challenge, so we see this is definitely the case in DR Congo, where technology is access to technology is a challenge. Like I showed you the rate for mobile ownership among women and girls, it's definitely quite limited. So in this case, we try to identify specific entry points. So it could be, equipping women centers with devices like tablets or mobile phones, or women leaders in communities or community workers. It could be through other entry points, like if you have partnerships with like radio programs, or it could be also, for example, UNICEF has a messaging platform called U-Report that goes through SMSs and WhatsApp, Facebook messages. So this could be also alternatives to disseminate Laaha. So what we do every time we deploy in a context is that we support in-country workshops on dissemination plan, and we ask our country focal points, counterparts, to hold these workshops with local communities, with local partners, and identify what those entry points could be. So obviously, Laaha is not going to fix the gender digital divide. There will always be this challenge. That being said, there is digital transformation happening even in those countries. Like I said, in DRC, female phone ownership or access to mobile internet went from 6% to 15% in 1 year. So that means that there is definitely an uptake. And so that's we have to see Laaha as another entry point to reach women and girls. And even in contexts where there are connectivity issues, where we are currently deployed, like Iraq, like Afghanistan, and so on, we're still seeing a really big reach, of users. So that means that there is still ways for women and girls to access those services, and we know that it's just going to increase with time. To your question about the presence of armed group and how do we mitigate those risks, I think it's also linked to those safety features we built on Laaha. And so I think it's about how at country level you're thinking about those mitigation as well. I see Ramatu Toure, who's the child protection chief for our DRC country office, is online. I don't know, Ramatu, if you want to come in on here on this question, how do we mitigate risks related to the presence of armed groups?
Yes, thank you so much. Thank you to Caroline for this excellent presentation. Thank you. Yes, actually, the way we see it is that we have, as we are in the process of developing and then launching it now, we are looking at all the different contexts. It's very, for what we have, the context of the armed groups is, of course, a context of distress, but it's not necessarily that it affects directly the individual girl with her phone. So what we are doing, we are also working with local organizations in areas where there is no connectivity. What is important to note is, like, as we are launching Laaha, we are also having a huge scale up of our physical safe spaces. So we also plan, and we also we are working actually on a three-pronged approach. We're having Laaha, which is virtual. We are having the physical safe spaces, and we are also having a major capacity building initiative whereby we are working with a local NGO that is specifically working on bridging the gender digital divide. So we are making sure also that the information that is on Laaha will also be accessible in the safe spaces. So the girls who are currently living in the eastern provinces, we do have our programs, so we can reach out to them and they can actually have access to the content, and they will have access to the content through the physical safe spaces. But what I want to say is, like, I know that there is a lot for us and that there's a lot of focus on the armed groups, but the individual girl is much at risk, as Caroline has presented, in a conflict affecting setting, as I would say in a non-conflict affected setting in the DRC. And I think the slides that Caroline presented show that. Thank you so much.
Thank you so much, Ramatu, for these great points. Jessica, does that answer the question?
It does very well. And thank you to both of you. And we have 20 minutes left, so we do have enough time, because I think the big reveal will be, Caroline, when you show them actually the platform and how to go through it. But before, I think I want just one more question, if we could. We had a few people ask about tech facilitated GBV, and sort of that since this is very tech-based, and maybe this goes back to you and the security measures that have been put in place, because a couple of our participants could see how this platform itself could perhaps induce some tech facilitated GBV. And I think it might speak to the security measures. So over to you, Caroline.
Yeah, thanks so much. This is an excellent question. So I think, as I said, when we started the development of Laaha, we started by asking women and girls what they wanted to see. I think that's going to resonate with probably everyone on this call, that who knows better than yourself what makes you feel safe or unsafe. So that's where we started. We started by just asking them, what do you want this platform to be? And when it was clear that they wanted, as I said, the most sensitive information on their body and health, and we know that only that is extremely sensitive, making sure that women and girls have access to the right information about their body is very political, it's very sensitive. And so in addition to a lot of other topics that I discussed. And so when it was clear that this is the information they wanted to have online, we also realized the level of risk they could be exposed to, because a lot of the women and girls are being monitored when they're using their phone by their father or their husband or their older brother. And so that puts them at risk if they are seen navigating those or viewing those topics. So we asked them, okay, that's an information you really want to have, but what would make you feel safe accessing that? So they told us, they said, we don't want to sign in. We don't want to have any information taken from us on the website. So they don't, they don't sign in, they don't have, we don't ask them for any identifying information. And then they said, we don't want that information to be on an app, because if it's on an app, it's on our phone and someone else can see it. So these are limitations, because it means that that information cannot be accessible offline. That being said, we are building an alternative to that I can talk about in a second. But what that means is that they were very clear about that. We don't want that information to be on an app on our phone because it can be seen. We want to connect to a website, and we want to be able to exit that website quickly. So that's why when I show you Laaha, you will see, or if you access it on your phone as well, you will see that everywhere you go in the whatever you're doing on the platform, you always have that exit website button. So you can at any point exit the platform if you feel that you're being monitored. Then in addition to that, we are giving them guidance as they connect to the platform on how to delete their browser history and how to be careful about some of those facilitated GBV forms or incidents. So as I mentioned with the IRC, we built like content on digital literacy, which includes online safety. So for example, one thing we were worried about is if we bring them online, how do we make sure that then they are not more exposed to going on social media platform and experiencing GBV there? Like, what is the risk versus benefit balance here? And so we decided with the IRC to basically adapt the curriculum that they have deployed in several contexts, including DRC. They have tested it in physical safe spaces. We put it online. And so we are giving them now guidance on like how to password protect your phone, how to safely engage on TikTok and Instagram and WhatsApp and so on and so forth, so that we also make sure they have access to that information and they can feel safer online. Now we are monitoring, we have a monitoring and evaluation framework, but also we are conducting an impact evaluation in partnership with Washington University, which also will help us to further shape and iterate and make the platform safer for women and girls. But from what we're gathering already from women and girls, like this, the level of safeguarding that we have built on the platform has felt satisfactory to them. So that's already what I can tell you.
Perfect. I think that was super clear. We have about 9 minutes left for you to take us through the platform. And I think people are really excited to see how that looks in practice. So I'm going to turn it back over to you, Caroline. You have about 9 minutes, and then we'll have 5 minutes for a closing. Over to you.
Great. Can you see it?
Yes, I can see your screen. It's on a Google page.
Yeah, okay.
Yep.
So I'll connect to laaha.org. Now, because I connect to laaha.org quite often, I can't walk you through the onboarding tour, but if you connect to laaha.org yourself, you will see that guidance I was talking about earlier about where to find the exit website button, where to clear your browser history, and so on and so forth. So you see already when I connect to laaha.org, on the top left, I have the exit website button, but then I also have a floating bar here on the right. And here I'm connecting from my laptop, so obviously the screen is bigger. But if you connect from your phone, it will look even clearer. We know that a vast majority of our users connect from their phone. And then that floating bar follows me. So at any moment, I can click on exit website, and it will take me back to the Google webpage. Okay, so that's the experience that women and girls wanted to see. Now, when I connect to the homepage, I have a number of modules that are being offered to me, and those are usually the latest modules. So you see one on like menstruation, find the support you need. So this is access to services, know the sign of healthy relationships. So here, if I click on learn more, I'm taken to the module. And I can navigate the module. So this is, for example, an interactive quiz. I don't think I enabled sound. Sorry, let me do that quickly. Oh, yeah, no, I did. So you see that everywhere I have text, I have voiceover, so I can...
Please note, All content provided on Laaha is based on scientific expertise for educational purposes only.
Okay, and then I have interactive quizzes, so interactive games. So here, this is a click through. Again, I have sound.
If you are referred to a health provider for mental health needs, you might see
and then here I'm recommended different content. So this is, for example, a podcast. I told you we had also podcasts. This is a podcast about healthcare.
Welcome to Let's Talk About It podcast, brought to you by Laaha.
Okay, and obviously there is also transcription if people cannot hear. So I'm just going to go back to the homepage. I won't navigate through all of the content, but what you can see already also, and it's all in the floating bar, is the Find Services page. It's also here. So if I click on that, that will take me to the services available around me. Now, I'm in Switzerland, and Laaha doesn't have services listed here, but we're actually working on that. But if I go to Lebanon, for example, you will see that I have all of the services, the type of service they offer. We are actually changing the terminology to make it more accessible. The phone number, sometimes the email, and yeah, so that's something that is available throughout the navigation experience as well. I can also search something. So if I want to know more about my menstruation, I can use the search bar and it will give me all of the modules related to that topic. I also have some of the suggested content. So here, for example, this is one of the tech and internet modules. So this one is about an introduction to WhatsApp. So for people to know more about what WhatsApp is, what is the purpose, how to install WhatsApp. So here you have click through, to know how to install WhatsApp on your phone, for example, how the storage works. And then we have a separate module on how to be safe on WhatsApp. So these are suggested modules. These are the categories, as I mentioned. So body and health, relationships and rights, tech, yeah. And then we have special topics. So these are the topics I mentioned on explore the digital world or parenting skills. Since there is interest on digital world, I'll show you this one. So you see, for example, there is using mobile data, using YouTube safely, how to identify misinformation on the internet, using Facebook safely. And yeah, we have, I think, around 40 modules on technology and internet. So this is part of how we combat also technology facilitated GBV. And then, of course, on the homepage, we also explain what Laaha can do for you and some of the quotes from other women that they wanted to share. And then, yeah, we have categories and subcategories, so you can also navigate Laaha through what you want to know, what is your situation. Like, I have questions about pregnancy and birth. So here you have information about pregnancy and birth, but you could also have access to other modules. So there is, as I said, there is about 140 modules. Here I can't show you the user forum and the chatbot because it's not active here in Switzerland where I live, but yeah, there is also the user forum and chatbot. And of course, when you're connecting from, like if you're connecting from Congo and your website is in your browser, so if you're navigating your browser in French, it will direct you to French automatically. So you don't need to do what I've just done to go to French. It's going to be there for you, Same for Arabic. if you're connecting from Sudan and your browser is in Arabic, you will see that directly for Arabic and with the content that is relevant for Sudan, because we can change the content depending on where you connect from, because obviously different countries might have different needs and different adaptations that are relevant to them. So I'll stop there. Obviously, there is a lot more to see, but you can also connect to laaha.org. Yeah, currently the DRC platform is not launched, so that's why you don't have Lala and Swahili that is there, and you don't have the services listed for DR Congo as well because it's not launched. We're still in the process of adaptation. But we still wanted to tell you about what our process has been to date. So I'll stop there. I don't know, Ramatu, if you want to come in here, if you have anything else to add about the deployment in DRC before I hand back.
No, thank you very much. Thank you, Caroline. I think that you covered it all. And as you said, we are in the process. It's extremely promising, and we're looking forward to the national launch. And just to say that we started with those 3 languages, and we hope indeed to add more national languages as we go on. Thank you.
Amazing. Thank you, Ramatu. Over to you, Jessica.
Thank you, Caroline and Ramatu. So just to summarize, you can access Laaha through the internet, regardless of what country you're living in. So you could be in Venezuela, you could be in Iraq, you could be in Kenya, you could be in Botswana. The distinction, and Caroline, correct me if I'm wrong, the distinction is that you might not have, if it's not specifically rolled out in your country, then you won't be able to access those specific service providers. Is that correct, Caroline?
So you can access the service providers from all over the world, but depending on where you are, we will show you the services that are available around.
Okay.
So you don't need to physically go back and navigate this. Yeah.
Okay, that's what I was thinking, because people were having a little bit of confusion of if you haven't rolled it out in their country, they can't use this resource. And I just wanted to reiterate that you can go online. I put those links in the chat. All of these resources, which are up to date, science-based, are available in those languages that Caroline spoke about. So you can access those freely.
Yeah.
Good.
If I may add also, Jessica, not only you can access those freely, but also if you want, for example, to use one of our video for your project because you want to embed it within your site or within, like, they are Creative Commons license. So that means that you can contact us and we can share the source file. As long as you credit UNICEF, you can use it also in other material. And I do encourage you to do that because I think a lot of the videos and podcasts we have developed are on topics that are not currently available on those formats. So we might have a one-pager and so on, but like videos and podcasts that are designed for women and girls on topics like family planning, on topics like digital literacy are not currently available. So we do encourage others to benefit from what our development process and consultation with women and girls, like co-creation process, has been.
Great. And I think just as a final thought before we go into our closing, Caroline brought up a really good way for us to still use this resource in maybe lower resourced communities, that we can use local women's organizations, we can use NGOs and other safe spaces who might have access to computers or online modalities. And this could be a vehicle for peer education or other types of awareness raising, because all the information contained on Laaha is accurate and then science-based, which I think is one of the greatest, and then most likely in a language that you can understand, ideally. So thank you, Caroline, very much. I have put the links in the chat throughout your discussion, but we will also be uploading this webinar to our YouTube page. And maybe Kabele or Shiva, you can put the link to our YouTube page in the chat. So you can find this webinar and all of our previous and future webinars on our YouTube page. And so if you didn't get a chance to see the links to the Laaha page or to the YouTube channel, you can find them on our YouTube page. So Caroline, thank you so much for joining us and your colleagues from the DRC. I can see that there was a lot of interest in this platform. And I'm excited to see how our colleagues working on country level can utilize some of these resources in their own work. And normally we have about 40% of our participants on our webinars who are representing local organizations. So we're really pleased to be able to showcase such a dynamic, I think, option for resources. So before we go, I know we're right at the hour, but give me 2 minutes because I do want to make sure that you know we have another webinar in our series coming up on Monday, which will be hosted by our member organization, UN Women. We will be hosting a roundtable discussion with focal points from intergovernmental agencies such as the African Union, the EAC, SADC, and others to talk about how they have been fulfilling their commitments to ending violence against women and girls here in East and Southern Africa. So please join us on Monday at 3 o'clock East Africa time, and that will be running from 3 o'clock to 4:30. So that's an hour and a half. And you're going to be able to engage and interact with some of our gender focal points from our East African community, from the AU, and then also SADC and some of these other also intergovernmental agencies. And then we'll also hear from some women's rights organizations and how they are engaging practically with some of these entities and on the ground. We will be sending out also our new video highlighting some of our human rights defenders, our adolescent human rights defenders. And if you could do us a kindness here at the regional GBV working group for East and Southern Africa, please do share those videos very, very widely so that we can really support and promote the work of these amazing adolescent girls throughout East and Southern Africa. Really, they are the generation that's coming up and doing the work so that we can reach equality and also end all forms of violence against women and girls during this 16 days of activism. So thank you all for joining me. Again, my name is Jessica Gorham, and I'm the Regional Emergency GBV Advisor, working on behalf of the Regional GBV Working Group for East and Southern Africa. Thanks so much for joining us. I will see all of you on Monday at 3 o'clock as part of our roundtable discussion with our intergovernmental agencies. And we're going to have a little bit of accountability. So I'm excited to see and to hear how they are working on behalf of all of us here in East and Southern Africa. So thanks, everybody. Thank you to Caroline and Ramatu as well, for our colleagues in the DRC, for joining us today. I hope everyone has a really great weekend.
Thanks, Jessica. Thanks, everyone.